I mean, during the course of these last few years, I can see that pre-interns are more enthusiastic and more participative like, and not only that, the organizers have taken interest to sort of make the non-medical personnel also use to contribute their experience. I mean, this is very helpful for interns, because whenever they are working in the society, not only the medical personnel, they should come across the feelings and the ideas and the knowledge what the other non-medical people also having. That will be helpful for their normal day-to-day life as well as their medical career also. So even in future, if you can extend that, depending on the time availability, if they can visit some places and depending on the time availability, if they can see and experience the different cultures and places of care provisions, that also will be more helpful. I think yes, that's right. I some decades ago, that nearly 4 decades ago only, I started my internship at Teaching Hospital Kandy. There, of course, we had very limited number of interns. When you consider the whole country, there are only 2 faculties. Altogether, we had only 250 interns for the entire year. So when distribution comes, of course, nowadays, since you are having 1,000 plus interns, even at the most periphery, they also are enjoying the interns services. So they enjoy as well as they can get the experience from the more peripheral setup, and at the center also, since they have more colleagues, they can dedicate more time for the patients, and if they can plan their future also very well, and they have enough time to think about these things and dedicate for the each and every individual patients also. So that is a good development thanks to the changing philosophy and the policies. Yes. Now, since right now, of course, I am working in the private sector, so when we were working in the government sector, so I am not going to say that being administrators we were not very concerned about the money matters behind our decisions, but especially when you come to the private sector, you always, whatever the actions or the decision you take, the superior management always bother and take concern about the rupees and cents behind your decisions. Now if you can give little bit more financial knowledge and environment for the activities, I mean, that will be more helpful, and that will help to cut the negative cost in the healthcare services, and we may be able to have more productive outcome of the interns when you make them aware about the financial involvement taking place, their decisions and activities happening day to day.